welcome the American College of Obstetricians and Gynecologists Video History Project. Today we're very fortunate to have the editor of the American College Journal, Obstetrics and Gynecology, editor Dr. Nancy Chescheir. Nancy, thank you very much for coming.
Such a pleasure, Ralph. I'm happy to be here.
Let's get a little bit of your background so our viewers will understand who you are.
All right.
Where were you born?
I was born on Long Island in New York in 1955. My parents had lived there their whole lives and childhood sweethearts. My dad was an engineer. My mom was a stay-at-home mom, although she regretted that. That's not what her life goal would have been. And my dad worked for the same company his whole life, but we lived in 6 states before I moved to North Carolina when I went there as a freshman in college at the University of North Carolina.
Why did you pick North Carolina to go to school?
Yeah, I had spent sort of primary school years mostly in Kentucky, and my brother had gone to a private school in the Northeast, and I was privy to those conversations that your parents don't really want you to hear about how expensive that was. So I kind of felt like I wanted to go to a state school and wanted to go someplace where I could become a marine biologist. That was my life's ambition when I was 18. And there was a decent program there. And there was also family members in the area. So there was a little bit of community that I could already step into.
But once you went to North Carolina, you graduated, you obviously did not go into marine biology.
I did not.
What changed you to think about going into medicine?
Yeah, so it was a combination of 2 things that happened my junior year in college. One is I was pretty broke, so I got a job, and I was in zoology, so I got a job washing dishes in a lab at the medical school, a lab doing bisonosis research. Bisonosis is also called brown lung disease. It's a disease of cotton mill workers, cotton mills being very common in North Carolina. So that was the lab I was in, and paid money for doing things that I wanted to do that were kind of fun. And that spring break, I took a trip with my invertebrate zoology course down to the Keys, and was having a great time learning a lot about interesting critters out in the Gulf Stream, and I pulled up a snail, and my teaching assistant looked at it and says, "Oh, that snail's never been identified." And he went gaga over this little snail, and I all of a sudden realized that really wasn't that interesting to me. And so I sort of did a left turn at that point, and in the meantime, through my work as a dishwasher in a lab, I'd been invited to grand rounds and was around the pulmonary fellows who would come in and work and talk in the lab while I was quietly washing the Erlenmeyer flasks and those sort of things, and I got interested in medicine that way. I applied to medical school my senior year of college. Did not even get an interview, much less get accepted to medical school, but tried the next year. Worked for about 18 months out at the Research Triangle Park, which is adjacent to Chapel Hill, and got into school that next year. And in the meantime, met my husband, who took my job when I went to medical school, and have stayed in the area essentially continuously since then, except for about 3.5 years. I lived here in Nashville, where we're recording this history.
When you were in medical school, what made you look at OBGYN as a specialty?
That's a really important question, I think. This was 1979. It was the summer between my freshman year and sophomore year of medical school. And I was doing a rural health assignment for the summer between the 2 years. It was in a small hospital in a community about 2 hours out of Chapel Hill that was also a mill community. And I was assigned to follow each of the primary care specialists throughout the summer. I would spend a week with a pediatrician, a week with a surgeon, not primary care, except for in that community, he really was primary care, a week with the family physicians. Actually lived in a hospital room. I'm sure I was covered in MRSA. If MRSA existed back then, it probably didn't, but I can't imagine living in a hospital now for 10 weeks, which is what I did. But I was on call for deliveries, and at night and on the weekends if I'd stayed there. And I got to see 10 deliveries. Those were the first deliveries I'd seen. In a non-random fashion, the 2 obstetricians in town made it in to see 2 of the 10 deliveries. And those 2 are the women that had insurance. And the 8 women that they didn't quite make it in for, who had beautiful deliveries by the nurses, were either uninsured or whatever version of Medicaid was extant at the time. And my feminist hackles were raised. The only time I heard those 2 doctors speak to their patients was literally to have the woman put her posterior on the bed, not quite phrased that way. And I was furious and really felt like women deserved better than what I was seeing, and thought the birth process was fascinating, but also thought that I could do better than what I was seeing. The next year I had the privilege as a second-year student to be taught by Bob Cefalo, who was a brand new faculty member at the University of North Carolina. He was doing a course in our reproductive biology course, 160 students in a tiered classroom, and he'd brought 20 placentas with Chuck's pads and gloves, and he passed them up the aisle, and everyone was playing with the placentas. Again, something I can't imagine happening now, and just got totally interested in it. But I really went to do residency to be a G1 oncologist. That's what I started out to do as an OBGYN resident because of some mentors that I had in that area in medical school.
And you were in the North Carolina program?
Mm-hmm. Yep, I've stayed at Chapel Hill all the way through. I'm a lifer there. I did undergraduate medical school, residency, fellowship, and faculty.
A true Tar Heel.
I am a true Tar Heel transplant, a true Tar Heel.
Right now, when you finished your medical school, where did you take your internship?
Yeah, so everything was there in Chapel Hill. This was pre-ERAS, of course, and interviews were going on mostly in the summertime. There was no real match. People called and offered you a position. So I was fortunate enough to be asked to stay on in Chapel Hill. Worked out very well. My husband, by that time, had a graduate school position at NC State University. So he's always had either schooling or his own career at North Carolina State. So we were very fortunate as dual career family to always be in the same area.
What were your plans when you were in residency? When you finished residency, what did you plan to do?
Well, it varied. Up until the end of my second year, I was going to be a G1 oncologist. I found in dealing with patients with G1 oncology problems that I loved the biology of what was going on, what was known at the time. I loved the surgery, but I was way too affected emotionally by the patients, and really got quite down about taking care of these women. Very few women, for instance, with ovarian cancer survived for very long at all. Cervical cancer was rampant. It was very difficult to take care of, as it still is, of course. But I just took it home too much, and so veered away from that. Became pregnant when I was a third-year resident and got really interested in obstetrics and maternal fetal medicine at the time. We had a fabulous maternal fetal division. As I mentioned, Dr. Cefalo, Dr. Watson Bowes, Dr. John Seeds, Bill Herbert, just some real amazing minds and mentors. And as happens so much in medicine, you get influenced by the people around you, and that's how I ended up in maternal fetal, was through those influences.
Did you take your fellowship at there also?
I did. I didn't interview anywhere else. was offered a position. And again, part of it was I knew it was a good training program. It was largely ultrasound based, which is what interested me at the time. It's not that way anymore. It's much more well balanced than it was at the time. And again, because I was balancing family issues with my husband's career, it was just a real blessing to be able to stay in the same place.
And what did you do in your career after you finished your training? Where was your first really appointment?
Yeah, it's going to be monotonous. I was at UNC. I looked at a couple of other positions because I felt like I should. And building on the advice of Dr. Bill Drogmuller, who was my chairman, his advice was you should go someplace when it's a better place to go, not when you're leaving someplace just for the sake of leaving it. And while I was fully prepared to leave, I didn't find any place that was better than where I was. So I stayed on. And I stayed on faculty from 1988 to 2005.
And then what happened?
Well, I was recruited to be the chairman at Vanderbilt, and I was there for 3 years. Ultimately not a great fit for either me or Vanderbilt, and I was lucky enough to come back to UNC, worked there half-time for a year, or 2 years rather, and half-time I helped to open a hospital in Boteswana. And so I lived half-time in Boteswana, half-time in Chapel Hill for 2 years.
Tell me about your Botswana experience.
Yeah, that was a life-changing thing. When I left Vanderbilt, the chairman of general surgery at the VA here at Vanderbilt was upset about events as they had unfolded. And Dr. Aburmarad called me and told me that he and another business partner open hospitals internationally, and they were under contract to open a subspecialty hospital or specialty hospital by 2 insurance schemes, as they were called, in Gaborone, Botswana, and they were beginning to build their medical staff. And by beginning, I was the first, and they invited me to come down as chair of medicine and pediatrics. I went not thinking I would do that, but interviewed and just fell in love with the project. And then over the next 2 years, as this hospital grew out of the rebar that it was in the situation when I got there, it opened in January of 2010. And I stayed on, ultimately being the superintendent of the hospital. And then my contract was over in June of 2010, and I came back to a full-time position at UNC.
What was that position at UNC?
I was just a faculty member in maternal fetal medicine, mostly doing ultrasound, but also involved in the fetal therapy program. I had helped to start our fetal surgery program before I went to Vanderbilt, and spearheaded a spina bifida, in utero spina bifida repair program before the MOMS trial. And then was asked to be the program director of that trial at the NIH for 2 years before I went to Vanderbilt. Vanderbilt was a site, so I ended up being a surgeon in that program at Vanderbilt while I was there. And then when I came back, the MOMS trial got published, and I began to work with Dr. William Goodnight, who is the director of the prenatal surgery program at UNC. So I began to help him with that program.
In all of this moving back and forth and around, when did you first get interested in writing and articles and journals?
Oh, this is a fabulous story. So Dr. Charles Hendricks was an associate editor of the Grain Journal and chair of the department of UNC. He had quit being chair, I think I'm going to say 1981, maybe early 82, but 1981. Bob Seflo, who is the new head of maternal fetal medicine, was the interim. And then when I started, Dr. Drogmuller, as I mentioned, became the chair. But when I was a brand new fellow, I wrote my first article, and the John Seeds, who was my fellowship director, said, "You ought to have Dr. Hendricks read your paper." So I had him read my paper, and he came in, and for those of you who didn't have the privilege of knowing Dr. Hendricks, he always he always taught by telling stories. You're laughing. He does. I mean, always taught by telling stories. But he
Yes.
came in and he clapped me on the shoulder and he says, "Do you really want me to read your paper?" And I said, "Yes." He says, "Oh, good, because it needs a lot of work." And then he said, "So Nancy, you deliver a baby and you always tell the mother it's a beautiful baby." "Yep, that's right." He says, "What do you do with the placenta? That's part of the baby." And I said, "Well, usually we discard it." He said, "That's right." He says, "Nancy, you have a gorgeous baby here, but you have a lot of placenta." So 7 rounds later, we were going back through edits where he was telling me to do things he'd already told me not to do anymore. And I talked to John Seeds, and he says, "Just send it in." So I sent it in. It was the only paper I've ever had accepted on the first round with no revision, so God bless him. And that was the start of my writing career. And I've published enough to be promoted along the way. I've got about 100 papers in publication. But the editor position, I think, is where you're going with this. That was interesting because I was on the editorial board of the Green Journal while I was in Boteswana. So I'm going to say it was 2005 to 2009, somewhere in there. And so I really enjoyed working with Jim Scott in that role on the editorial board. But when he announced he was retiring, it never occurred to me to apply to be the editor-in-chief. And one of the fellows at UNC, Dr. Casey Eichelberger, cut the announcement out of the Green Journal and put it on my desk at UNC one day and said, "This has you written all over it." I said, "Oh, Casey, that's very sweet of you." And then someone else said the same thing. And so oftentimes I think people see things in you that you don't see yourself. And if you listen to them, sometimes you get pushed in an interesting new direction. So I applied for the position and was fortunate enough.
The rest is history.
The rest is history, as they say. So, and it wasn't my life's passion to do this. It was one of those wonderfully serendipitous things, sort of like the snail in the Gulf Stream, that ended up changing the course of what I do.
One of the interesting things about what you do is you're the first female editor of the journal.
Mm-hmm. I've sort of been on the leading edge of women in OBGYN, and as far as large numbers of us, and the first woman to do quite a few different things. I was the first woman fellow in maternal fetal medicine at UNC. I was one of very few women on the faculty when I first started. I was the first ever clinical female chair at Vanderbilt in any department, and as you say, the first woman editor of the journal.
Do you see yourself originally as a pioneer in that regard?
I think the evidence would suggest I am. I'm not sure that I've done. I don't know how to answer your question. Yes, I am. I guess a pioneer. I'm the first to have done many of these things. But I think that pioneering suggests sort of like you've set out to do things. I'm not sure I set out to be the first. I think I've sort of serendipitously become the first.
But you never turned down an opportunity.
No. I'm willing to take some risks and try some things.
Well, let's take you to the journal.
Okay.
The journal has changed under your leadership. Why did you make those changes?
Well, there's a couple of things about the changes I've put in place with the journal. Part of it has to do with some ideas to engage junior fellows, particularly. But part of it has to do just with the world of publishing right now and the way science is going. We're in an age when skepticism about evidence, skepticism about the way science is done and published, the rigor of the peer review process, whether you can believe the science or not, is rampant. We're dealing with in a world of fake news. And so I felt very strongly that we need to be very transparent about what we're doing. in the journal, and to make sure we're maintaining very high standards around the peer review process particularly. So, for instance, we right now have about 1,500 active reviewers with the journal. We get about 2,000 papers a year, publish about 20 a month. And when I started, there were not that many women who were reviewers. And so I've worked hard to bring on new reviewers, both men and women, but help them. So I guide all the new reviewers through their first 4 reviews, give them feedback, evaluate how they're doing, make sure that the ones that get promoted beyond being a new reviewer meet the standards that our editorial team agree are appropriate standards. And now we've got a group of new reviewers who are very active, who I have confidence know what they're doing. We provide them reading material and things to think about. I think that's incredibly important. Other things that I've done are we've made a decision as an editorial team that we would, for instance, bring on one new feature every year, at least one new feature. Original research is always going to be our main focus, and that's well over half of what we publish. But we've also done things like Connect the Dots, which is a feature that is really quite popular from what I hear, and that was done specifically to get the junior fellows involved, because the co-authors on that feature are all junior fellow members. That, I think, is super important to have done that and to try to engage them in that way. Other things we've been able to do include focusing on clinical practice and quality. We've got a number of different features that I've done to try to align in part with things that are going on in the college. So practice is clearly a major focus. Quality is clearly something that's much more important now than it was 15 years ago, as far as the rigor of addressing those kinds of questions of how you practice high quality medicine. So I've made sure that we've tried to keep up to step with that.
A number of the things that you've added to the journal, in my opinion, have added to its readability.
Interesting.
It's having been associated with the journal myself for many, many years, some of them are very interesting, and I love the way that you've put some of the, how shall I say it politely, the lead authors into a position where they have to be able to defend what they've been saying.
Yeah, I mean, we insist that they do things like give us a hypothesis, give us a primary objective, give us a secondary objective, and then organize their paper around those. We're very careful about spin. And so spin being where you maybe had a negative outcome in your primary objective, but one of your secondary objectives, which really should just be hypothesis generating, was significant, and so you spend all of your discussion talking about your secondary outcomes. And so we do hold our authors' feet to the fire with that. We've also really enjoyed having a podcast that I've been able to do once a month with the web editor right now, John Fisher. Started with Bill Dodson, and that's been great fun. And what we do is talk about the 3 editors' picks. So myself and the Dwight Rouse, who's the associate editor for Obstetrics, and John Chescheir, the associate editor for GYN, each pick our top paper in our area for that month, and then the editor picks podcast, that's what we talk about.
But you also bring in editorial board members more than has ever been done in the past.
Yep. We try to do that. I think the editorial board works really hard. If you're an ed board member, you review 8 papers every 3 weeks. It can't just be grunt work. You got to bring them in, and they're selected because of their expertise and their commitment to the journal, and I want to celebrate that and let them have more of a voice.
What do you see the future of medical journals?
Well, I think there's an awful lot of pressure on journals right now, and currently we're dealing with the whole switch to open access. Open access being sort of vilified because it's been, in my opinion, bastardized by the so-called predatory journals, and I'll explain that a little bit. What open access means is that you, the reader, don't have to pay to read an article. And there's a lot of good democratic reasons why that should be. You're the taxpayer, you've probably paid for a good deal of the research that's being done in one way or the other. And in a way that makes sense. The business model for our journal and for many of the biomedical journals is that you either get it as a membership benefit, and so you don't directly pay for it, you pay for it through your dues, or you get it through a subscription model. And the open access model is going to push up against that right now. I think the pressure that's coming out of Europe and the Gates Foundation and others through what they're calling the Plan S, which is specifically written to blow up the publication business as we know it, will force us to become an open access system. And I think that's going to be huge. How that's going to play out, I'm not sure, but I think that's going to be an enormous change over the next 5 years.
You think it will be more influenced by the internet or by the paper?
Oh, I think paper journals will go away, quite honestly. And I'm not sure that I see that as a positive in the next 5 years. When we do readership queries, a lot of our readers like having a paper journal, having it with them in their briefcase or their handbag, and pulling it out and reading it when they have time. Honestly, not that many people read a journal cover to cover anymore. And so in that way, I think it's going to go more digital because people are going to be using just-in-time reading. They may not ever read a journal front to back. The other thing that I think is coming that's going to be a challenge is what's the role of the advertising. That's a big pressure in publications in women's health right now, is because there's not that many, for instance, drugs coming out. And the pharmaceutical companies buy advertisements. If they're not coming out with new medications, they're not going to be paying for advertising. And so all of these things are going to be big pressures, I think, on publications.
How do you handle the situation of the advertiser that insists that their advertisements be adjacent to articles that relate to them?
Well, that's actually not legal in the world of advertising. And something that Jim Scott started that I've continued is that as editor-in-chief, I look at every new advertisement that comes to the journal, either on the advertising online or print. And I look to see what the evidence is that supports what they're saying. I've insisted that they change what they've presented their information, or added on that a reference that might counter what they're advertising so that it's a bit more balanced. But you actually cannot co-place an advertisement with an article. So one of the very funny stories, when I first started, Catherine DeAngelis, who used to be the editor-in-chief of JAMA, was on the search committee when I was selected as the editor-in-chief, and she volunteered to mentor me a little bit and was our first speaker at our editorial board meeting. And she was really trying to coach me about some things. She had said that this was many years ago, that some advertiser was insisting on buying an advertisement in a particular week of JAMA. And she just couldn't understand it until she saw the layout for that month, and it was exactly what you were talking about, an article about what they were advertising. And so she capitulated. She said, fine, you can have that week, but she pushed the article off for another week. So they got what they wanted, sort of. And it really raised my understanding about those kind of issues. So I've really tried to become very aware of them. The other thing I've been able to do is I'm on the COPE Council, COPE being the Committee on Publication Ethics, which is an international volunteer group of people involved in all sorts of academic publishing, not just biomedicine. It's social sciences, publishers, editors, all sorts of folks. So gotten to become very familiar with many of the ethical things involved in publishing, and that's been a lot of fun.
Let's say that a young resident or a young faculty member who's been out for a couple of years comes to you and says, I notice you're the editor of Journal, and I would like to eventually become an editor of Journal. What would you recommend to this person that they do?
Yep. So one of the things that we've been able to do for the last few years is have twice a year the college pays for a person who competes, applies to and competes and comes and spends a month with us at the, well, it's not a full month with us. It's usually a month's rotation where they spend a whole week with us in the journal office, and they learn how the journal works from front to back, what all of the staff do, which is an enormous amount of work with a very lean staff, very skilled staff. But they learn everything from soup to nuts about how a journal works. And then the intern, we call them an intern, but they're with us on our editorial calls every week, so they learn how the editors and the staff make decisions about what articles to publish and what not to publish. The other thing I think they should do is they ought to publish papers and they ought to review papers. And I think anybody who publishes ought to be reviewing, because it's peer review, it's part of the work of being in academics. I think they ought to be looking at doing that for a couple of different journals so that they get a flavor, because you've seen one journal, and figure out different things about different journals. And then get on an editorial board and gradually work up through the system.
Nancy, thank you very much.
You are most welcome.
I've enjoyed all of the comments you've made. It's getting an insight into the Green Journal. Obviously, the Green Journal, I think, is the best of all the
Absolutely it
OBGYN,
is.
and I think you've done well to keep it that way.
Thank you.
And actually to improve it. It's getting better. So thank you very much for being with us today.
You're most welcome. Thank you for inviting me to talk.